Thank you, Nisar, Dr. Neha Kakkar. Good evening, good afternoon, and good morning. This is the 1638th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Indraneel Bawadekar. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have an international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. All these sessions are going in a good way, and we are uploading the videos of the same on the very next day itself, so that those who missed the session can watch it again, and you can subscribe the same without paying any money, as well as you can share it with your friends, whether it be a homeopathic doctor, student, or homeopathic lover. The purpose of the forum is to take homeopathy to every household around the world. And we have presentations from more than 65 countries, and almost all presentations were brilliant. Let me come to today's guest. As you all know, today our guest is the first timer, Dr. Indraneel Bawadekar. And doctor has completed MD Homeopathy, then having an additional professional degree of LLB, and he has a diploma, a DMJFM, and PG diploma in forensic medicine. He is known as a homeopathic nephrologist and practice in Narayanpet and Kothargud, Pune. He has more than 31 years of clinical experiences, and his subject of interest is to explain medical laws to doctors in simple words. He has taken more than 50 CMEs to doctors as well as students. So this is we are lucky to have such a wonderful personality in this forum, because nowadays a lot of laws are being implemented by the governments, and we need our own expert to study on the laws, particularly medical bill. We have a wonderful medical bill which was full of troubles, but due to the our interference of particularly the homeopathic medical community, all the associations as well as the IFPH has done a lot of work to change the mind of the persons who are making this law, and thereby homeopathy also was given a better part in our medical bill here. Still, we need some more changes in the bill. So, an expert like Dr. Indraneel Bawadekar can do a lot of help to protect homeopathy in the future. So we proudly welcome, as you all know, the subject of the day is also a very, very interesting one, and that is something related to the law itself. That is essential things in clinic from eyes of law. That means that's a very, very interesting subject. So we proudly welcome Dr. Indraneel Bawadekar to this session. Welcome.
Thank you, sir. Thank you, sir, for the kind introduction. I'm very happy as well as lucky to be associated with IFPH. Daily friends, you all are observing me at the end of the lecture, probably asking 1 or 2 questions. Many a times they are from law point of view. So these questions are raised, and all our speakers are very competent, and I'm happy that they answer very well. Without wasting time, just 2-3 lines and we'll go to the subject. Friends, we all know that we were taught laws in forensic medicine, and after passing out, we don't know what are the laws. Nowadays, not only homeopaths, but all the branches are facing many problems because they were deficient in the knowledge of law, which is necessary in our medical practice. So today, shortly, we'll be going through all the necessity things. Basically, I would like to say this is an international forum. So different laws of different states and countries are there. So like from India and Maharashtra, I'll be concentrating on the basic things required legally. You may confirm with your own states if there are any changes in that. Secondly, I will be covering the topic 15 minutes or 10 minutes before. So I would like to have some questions from you. You can write it to Dr. Dhanesh sir in the chat. And if he allows, you can unmute and ask me in the last. So but kindly do not interrupt me in between. So we'll go through the slides now. So can I share the screen? Yeah.
Yes, yes, yes.
Sir, is it visible?
Yes, it's visible.
Okay. I think I am audible also.
Yes, yes, everything fine.
Okay, okay. Thank you for IFPH International Forum for promoting homeopathy. Friends, today I request everyone to relaxly sit in a chair and listen about the laws involved in our medical practice. Academic sessions are daily there, and this will be a feast for you in this academic session. So friends, be relaxed and just go through the slides which I show you. This will be very, very helpful to you. Just yeah. Today we are going to talk on essential things in the clinic from the point of law. So what are necessary which we require, because sometimes if we are deficient, we land up into problems and we welcome different things in medical practice, and that disturbs our daily routine as well as we are sometimes fined also. So friends, in a relaxed mood, I will say this is a homeopath in my eyes. He's a very, relaxed fellow. He's very enjoying. He's very happy. A homeopath notes down the cases, the symptoms. He interprets it and he gives services to the society. So such a happy fellow is a homeopath in my eyes. So we should appreciate a homeopath within all doctors. But friends, now this homeopath or this small happy creature is facing problems like lions, and these are just sitting next to us. We don't know, but there are many people who are observing us. Many different systems are there, and they are just waiting that if you make some mistake, they will sue us or a homeopath in the court of law. So we all should be very much confident. We should be knowing what we are treating, and now we'll see what things we can do. Only one thing I would like to say, that this lion like giant or lion who is going to trouble us in a shape of a problem, we can make him run away. Don't worry. Two things are very much necessary. One thing is we should have unity amongst all homeopaths. No criticism, nothing. We are talk professional ethics. So we all should be one. Whenever our any friend, any colleague or a practitioner faces any problem, we should all come together. And if we have any little knowledge about things essential in the clinic, we can make this lion run away and nobody will be coming in his hands. This is my assurance to you. Now, probable causes for doctors' problem. Why are they facing problems? This point may be coming in your mind as well as my mind. Here I attend courts with my friends also, and then we see, oh, doctor was not aware of this and this is deficient and he has landed into a problem. So probable causes, we will discuss. The list is very big. One is essential things in our clinic were not taught to us during our college days. We did our academics, we passed our all UG, PG, but nobody taught us anything that from legal point of view, what is essential. Only thing, we took our registration number, we opened our clinics like a shop and we started practicing. Some seniors guided us, but they were not lawyers, so some deficiencies remained in that. So these were the probable causes. Secondly, lack of medical legal knowledge in medical practice. Since we were not taught, it is not our mistake. But except forensic medicine, we never knew what are the laws in medical practice and do really law are applicable to our practice. We were not aware. We were bona fide for this. So there is a lack of medical legal knowledge. Hence we land up into problems. Say, another thing is comparing other pathies and practitioners. I have seen many homeopaths comparing the conventional medicines. What is there in conventional medicine? See, I can do this. See, I can do that. See how homeopathy works. See, there are no side effects. Friends, as a part of professional ethics, this should not be done, because too much discussing this attract medical legal problems. People, those who are getting hurt, they just wait to make you mistake and you are caught in the eyes of law. Now, usually these things like doctor-patient relationship, doctor-doctor relationship, they all come under professional ethics. We were having the subjects during our LLB course. We had 28 subjects for 3 years of LLB course. But unfortunately, in medical field, Professional ethics subject was not there for us, so we were not aware of it. Lastly, I would like to say, accepting challenging cases in private practice without experience. During COVID, I had consulted many doctors who were in problem. COVID pneumonias, ICU cases, everyone were accepting the challenges. Everyone were giving genus epidemicus, and the cases which were really requiring hospitalization were challenged by giving homeopathy. I salute to the knowledge of everyone, but we should know a admission case has to be admitted. A OPD case has to be treated in OPD. If we all are trained in OPD practice, we should accept only cases of OPD. We should not accept the challenges of ICU cases, difficult cases, terminally ill and declared incurable by others. We should not accept and give them tall claims. You can accept, you can help them, but not all claims should be there, because if you do that, certainly you are going to come in the eyes of the law. Now, this in clinic, now what are the essential things in clinic that we will see? Because many times we don't know what are the essential things. We just keep on just saying, okay, I have opened a clinic, my practice is going on, people are coming to me, they're getting patients, but we should be aware. I come to the point of the records. See, complete record of the attended patient should be there. We should never neglect to write down the records, daily our daily book, who visits us, what treatment we have given, what is the diagnosis. Without any hesitation, even though there is a rush, you should have a complete record. Legally, it is said that we should have a 3 years record of our patients. And from our income tax point of view, we should have it additional 5 years, that is 8 years record. Now it has come to 6 years now, the recent correction of income tax. So this much record we are supposed to have in our practice. I will tell you the another advantage of this record thing. Suppose a patient comes to you and he said, sir, 4 years before I had come to you, and kindly give me my case paper and kindly let me know my treatment. You can deny it from law point of view, because in OPD, you are binding to give only up to 3 years. So beyond 3 years, don't give any records to any of your patients. So this will be helpful to us. Now, as per Chapter 1 and Section 13 of the Indian Medical Council Ethics Regulation Act, the RMP shall maintain the medical records to his or her patients for a minimum of 3 years from the date of commencement of the treatment. This is the legal part of the record maintenance. So what are the contents of the medical records that we should know? Medical records are fundamental parts of our doctor's duty in providing patients care. Handwritten medical records are given highest value in the court of law. Our case papers which are handwritten are given highest value in front of the judges, honorable. Our clinical notes. Sometimes now even electronic media is accepted. So our email, our scanned records, our consents taken in the form of text, verbal, or any correspondence between the health professional, lab experts, X-rays, photographs, all are accepted by the court of law as a part of evidence nowadays. Even video recordings are nowadays accepted. Previously, electronic record was not accepted, but after the BNS, that is Bharatiya Nyaya Sanhita, now it has been accepted in the court of law. So we should have records to show all the details of our patients. Now, documentations and record keeping. See, maintaining accurate and confidential patient record is a right of the patient, and it is mandated by the Medical Council of India. Every patient, has a right that his record should be kept confidential. Only he should get it on his own demand. If he is less than 18 years of age, his parents may give us in writing for the medical record of our OPD. We have a duty to provide a record within 72 hours. If the police ask us, if the relatives ask us, it is a binding on us. Secondly, if the patient is above 18 years, he directly can ask us for all the medical records. So we should provide that. Now, medical legal documents. Proper handling of medical legal cases, they include all the injury reports, death certificates, all things are there. That should be also in our records. It is very essential and we should keep them. Now, retention of records, how many days should we do? This question will come to your mind. Is 3 years complete, we can say, end to everything? No. In each and every criteria, the record date changes from place to place. This is a chart. If you want, you can take a screenshot of this. This will be showing you how many days we have to keep a record. For example, OPD patients record should be for 3 years. Those who are having homeopathic hospitals, the record should be kept for 5 years. Then medical legal cases, those who are there, any case, that should be for lifelong. The papers should be kept in our lockers like our ornaments. They can be asked anytime by anyone at any time during our lifetime. Then medical records of pediatric patients up to 18 years of age, birth registers and death registers lifetime, casualty registers also lifetime. For we don't do gynec practice, but gynec's MTP register is for 5 years, OT registers 30 years, then PCP India 2 years, biomedical waste record that we should have for 5 years. All the 5 years record of the receipts of our payments of our biomedical waste given everything. For income tax, I told you it is 8 years. Now they have reduced it to 6 years in Maharashtra. Then ICMR guidelines 10 years for a national registry. Administrative documents, if you have anything, the limitation you have to keep maximum is for 10 years. So I request you, you can have a screenshot of this so that you will refer it how many years you have to maintain a record in our medical practice. Penalty for the breach of records. According to the Health Record Act 2001, breach of the act may result in fine. In some cases, it may also be a civil penalty under the My Health Record Act, which can be decided by the honorable court. The court may decide either you have to give penalty or is there any imprisonment for, disturbing the record. Now, consents. Informed consents. Obtaining consents from patients before any medical treatment, especially chronic and incurable cases, should be there. Many people come to us for second opinion. We are second opinion doctors. People come to us where everything fails and they think homeopathy has got a ray. Definitely it has got a ray. But in cases such sensitive cases, we should always take the informed consent signatures of the patient, and the confidentiality of these records should also be maintained. So these consents are very important. And the consent which should be taken is called as a valid consent in the eyes of law. That means the patient should be sound by mind. He should be well oriented. He should know what he is signing for and what consent is given. He should be explained in his own mother tongue language. So that is very much important. Now, transparency in the treatment about disclosure of name and doses of medicine. Every homeopath should do it. No hidden practice. If the patient asks us, we have to disclose the name of the medicine. We have to disclose the potency, the reputation. Many homeopaths get angry when the patient asks us, "Mujhe kaun si dawai di thi?" No, it has in the eyes of law, you have to disclose them. A family doctor or RMP can legally dispense. This is also an issue whether homeopath can dispense medicine or no. You can definitely dispense, but he has to follow certain conditions. But a homeopath cannot open a shop or cannot import drugs. You have to purchase it from a registered DSR, and then he has to keep the record of the same. That means registered pharmacies we have to purchase and keep the receipts. That is important. If a homeopath wants to be a homeopathic chemist, then separate applications are there. All the bills, drugs which you have got should be with authentic pharmacies, and we should have original bills. Many pharmacies give us offer 1 + 1 free, 50% discount on the MRP. These pharmacies do not exist. I have seen in last 30 years. Their life is for 3 to 5 years. After that, these receipts are not traceable. Their addresses are not traceable. If something goes wrong, we cannot go to any place because the pharmacies get vanished because they close down their business due to some malpractices. So you should take it from authentic pharmacies. Rules regarding keeping and dispensing of the drug by the RMPs is a separate lecture. I will tell you the long form of RMP. RMP means a registered medical practitioner. In the eyes of law, nowadays, allopathic doctors are said as RMPs. Usually they are referred, but we are also RMPs in our own faculty. So we are registered medical practitioners in our own faculty. So like a homeopathic RMP is in his own homeopathic faculty. So these different short forms are there. I will definitely explain you when they come in front of us. Shop Act. Now our homeopathic clinic is a shop, they said, but now it has been scratched down. Now it is not mandatory for us to have a Shop Act. Only if you have homeopathic hospitals or IPDs, then the Shop Act is mandatory, and all the rules and regulations regarding the Shop Act should be followed as described in the Shop Act rules. So nowadays OPD people do not worry. Biomedical waste and registration. Everyone we are supposed to do the registration. Many homeopaths tell me, sir, we don't generate biomedical waste. We don't generate any dressings. We do not do any plasters. We do not have any spirit swabs. Our clinic is a homeopathic clinic. But friends, laws are the laws of the land. We have to respect them. For a registered medical practitioner At present, biomedical waste has to be registered. You have to every year register, pay the fees, and you have to take the services. If you are not generating, you can write a letter to them, but you have to register yourself. That is mandatory. If IV injections and dressings are different, they are for allopathic clinics, not for homeopath. Now, doctor has to follow the rules even for disposing the biomedical waste, like separation of in yellow and red bags. Even if at our home, our parents or our relatives, they have diabetes, we check on glucometer the sugar. So friends, we are generating a biomedical waste. The needles are also there, which we prick to take a blood. They should not be put in our dustbin. They should be put in a biomedical waste, red color bag or a yellow color bag, and they should be given to the people who collect it. Every year, the fees are to be paid and the receipts are to be maintained. Here also, many people come and check in the clinics whether you have paid biomedical fees or no. And if it is not there, it is a fine. I remember one of my friend is a homeopath over here. He was given only 24 hours notice. He did not have biomedical waste, and they told us within 24 hours we are going to seal your clinic, and you have to close down the shop till this goes. But here, like we helped him, we convinced, and we told the authorities. They also listened. Immediately, he took a license, and he got saved from it. So, friends, these actions can happen. So we should have it. Penalty is also there for violating the rules of biomedical waste. You cannot throw it on any dustbin or any common area, all the generated waste. Now, certificates of display. This is, a very interesting thing for a homeopathy, because, so we should know that what is our degree. Homeopath has many degrees, like we had diplomas first, now we have graduations, we have post graduations, now we have PhD also. So these all certificates are to be displayed in the OPD, that is a rule by law. And there is also a usually said thing that when we sit behind our chair, all the degree certificates and registration should be displayed, because the patient will be sitting in front of us. He should easily view them. And the original certificates are supposed to be displayed inside our waiting room. Outside our OPDs or our waiting rooms, Xerox copies will do, but original should be behind us. That is expected by the law. Now, every patient should know our degree, our university and registration, from where we have passed, how many years experience we are having. It is right of a patient. So every patient should know it. If somebody asks us smartly, friends, kindly do not get angry. Explain them, I have passed from so and so. I am experiencing this field for so and so years. So this is very important, where to display our certificates. Now, misleading advertisement. Many homeopaths are doing misleading advertisements and they are coming in trouble. Basically, a doctor should not do an advertisement. Is a basic, wrong by law. We should not make public places advertisements. You can put boards outside your clinic, but you cannot advertisement on social media, advertisement on different common places. It is usually not advisable. No boards of advertisement of cure with magic remedies to be displayed, as these are punishable under Drug and Magic Remedy Act of 1954. That is called as Objectionable Advertisement Act, Section 3. For example, some homeopaths write that cancer cure boards, renal failure boards, stroke cure boards. These are commonly observed the advertisements on common boards. They are punishable by law. Board should be clear with your degree obtained and specifically mentioned in mentioning your system of medicine which you have passed. For example, if you have done your MD in homeopathy, it should be MD homeopathy, Dr. XYZ. If somebody is from Ayurveda, it should be MD Ayurveda. If it is from medicine, it should be MD medicine. If somebody has done DNB, Diplomat in National Board in Nephrology, he should display as MBBS DNB Nephrology. So the board should be so clear and clear cut for advertisements outside your clinics. Nowadays, these recent courses of post-graduation are going to start from next year in homeopathy. Now, clinical oncology, clinical rheumatology, pulmonology, pediatrics, psychiatry, neurology, and endocrinology. When friends you pass out these courses, you can surely highlight yourself as a homeopathic pediatrist, as a homeopathic rheumatologist. You can do that, but not now. There are some cases from Kerala which I have shortlisted, and this is for information only. The cases are very big, 50 to 60 pages, but I have shortlisted them. See, these are against homeopaths, which the court had made some decisions. The case one is
Excuse
state of
me, you are
Kerala.
going to Dr.
Yes.
Indraneel, please reduce your speed. You are going so fastly.
Okay, sir. I should go fast. Okay.
You
State
should
of Kerala versus Dr. K. Suresh. In this, a homeopathic doctor was charged under the Drug and Magic Remedy Act for advertising miraculous cures for infertility and cancer. The court upheld the prohibition on such advertisements. Secondly, Dr. Ramesh Kumar, Medical Council of India, court ruled out that homeopathic practitioners must adhere to the ethical standards only and not mislead the patients with exaggerated claims about treatment of such rates. Many homeopaths do this. Now, State of Kerala's Consumer Dispute Redressal Commission, Dr. PK case in 2019 showed homeopathic practitioners was penalized, means like he was charged for some fees for misleading the patient with advertising himself 100% cure for asthma and diabetes. We should not make such false claims. He was punished for this homeopath. Now, employment and labor, staff qualification should be there. See, a staff should be qualified and basically he should know that what are the homeopathic remedies. He should be able to read it. We employ anybody under our own experience. And if the staff makes a mistake, by law, the doctor is punishable for this, not the staff. So basically, the staff should be educated, he should be trained, and he should work as per your talented knowledge, not like a doctor, but about the names and the doses which are to be dispensed. Labor compliance should be there. So regarding the hours of working, the minimum wages act for the laborers has to be given. If some worker is with us for 3 hours or less than 8 hours, he's a semi-skilled worker. So according to the minimum wages act, we should pay him. We should not underpay him. After 3 to 4 years, he becomes, even though part-time clinics are there, he becomes a skilled worker. So all the things which are applicable in the labor laws for a skilled worker are applicable to him. For holidays, bonuses, we should be aware of these things. We should not just keep on paying him and be relaxed. Okay. Now, life-saving measures. Our visit back should be having life-saving emergency medicines. No doubt, if they are homeopathic medicines, but we should have it in our clinic. That is very important from eyes of law. For saving the life of patient before reaching to a hospital, this is very important. Suppose somebody comes in a cardiac shock due to myocardial infarction, you can give your own medicines. You can give aconite, you can give belladonna, whatever you feel, carbovesh, it is up to you. But you should have them prepared. Now, proper application of CPR. Every homeopath who is practicing should know CPR, because we hear about CPR, we think we see CPR in YouTube's, we see videos, but when it practically comes to us, we are not able to give CPR. So in the eyes of law, CPR should be known for every practicing, or not only homeopath, all the doctors. In fact, I request IFPH if they can arrange a lecture for CPR, it will be really helpful to all, because we know it partially, we have never done it. So like surely this point should be noted that CPR should be known to each and every practitioners among us. Failure to perform the above will contribute to negligence for a homeopath. If we do not give CPR and we are not able to give, then it is a medical negligence for us. Some more taxes are also applicable to us. We think that income tax is paid, so everything is all right. But their profession tax is very important to us, which has to be paid before 31st July every year. And this tax is calculated from the date of registration of our medical degree. So once we get registered certificate, from that day it is calculated. In Pune, people received a notice of 10 years backdated professional taxes which they have to pay in thousands. So kindly ask your chartered accountant and start paying the profession tax. There is a different number of profession tax which every doctor gets. We should have this, because some or the other day a letter comes to us. Professional indemnity and insurance for safety of doctors. We all should have this indemnity for our clinics. If something goes wrong, if some by mistake, lakhs of rupees, now we can say, I have seen in crores that they are fined for a doctor. From where to get this money? From our lifetime practice also we cannot pay. So for this purpose, as a backup, we should have a professional indemnity insurance. They are not expensive. A 20 lakh rupees insurance of your clinic will cost you only 700 to 800 rupees per year. So kindly go for this insurance. Yes. Now, insurance continued. Some professional liability insurances are there. Considering and obtaining professional indemnity, I told you, property insurance should be there, because you will think it is not important, but it is must. Because of some natural disasters, if the property gets destroyed, if you are insured, then definitely all the load, your financial load will come down. That is there. Fire safety. Fire safety is important for all OPDs. We are not aware. So this fire safety equipment is available for only 700 to 800 rupees. Everyone should keep it in our clinics, because Some wrong time may come anybody on anyone. And every year this has to be filled. There is a red meter on it which shows us the CO2 levels, and it is very easy to handle. It has got a seal over it which can be broken, and in emergency it can be used. You can use it at your home also and in the clinic, but it is mandatory that you should have it in your OPDs. Now friends, these are some sections which you can also have a photograph and you can post it in your OPD waitings. Patients misbehave with us, and for there are punishments. Previously it was IPC, that is the Indian Penal Code. Now the criminal laws are changed to BNS, that means the Bharatiya Nyaya Sanhita. The code, Indian Penal Code sections are not important for a homeopath, but for the relatives, they should know that there are punishments for their deeds. For example, if a patient misbehaves with the doctor or the nurse or the staff, he will be imprisoned for 2 years. That he should know. If a patient uses abusive, offensive, obscene words, there is a 2 years punishment. If a doctor is threatened in his clinic, there is a 3 to 7 years punishment for the patient. That the patient should know, not we. We know, but the patient should know. If the doctor is beaten, we see unfortunately doctors are beaten, then also 3 to 10 years of imprisonment can be given to them. In case of damage to the hospital or the OPD property, 3 years imprisonment can be there. And if forced in the hospital, 6 years imprisonment can be there. You can post it the Xerox outside in your waiting, so that whenever the patients are sitting, they look here and there and they know for their misbehavior what can happen. That is very important. Now, ethical and professional standards should be there. Code of ethics should be maintained by all of us. The Code of Medical Ethics and Regulation Act is there from Medical Council of India. Now we have Homeopathic National Commission 2020. Once in lifetime, whenever you get time during practice, everyone should read this Homeopathic National Commission Act, where all the ethics of practice, professional communications, everything is given in that. Then secondly, there should be a continuous medical education. And every doctor should engage for the continuous ongoing medical education. We should be updated on ourselves, because there are very seniors. I respect all the doctors from our forums, but probably during their days, some diagnostic procedures were not there, and now they are available. So as a homeopath, we should know it. Some intervention things are there which a homeopath should be aware. Everything we cannot say that we are symptom hunters. You tell me the symptoms, I give you the medicine. It should not be in that way. We should know where a person requires a surgical intervention, what are the things. But definitely, if we are aware, even the confidence of the patient increases in us that we are an updated doctor. So they are very important. Yes, I give an example. Hypertension patient we are treating homeopathically. If he has got a renal artery stenosis, that stenosis is a surgical condition. It has to be removed immediately to save the kidneys and the future dialysis. At least we should be aware of this thing. We are going to treat him with homeopathy, but some interventions can be done. So as a part of knowledge, we should have it. And for that, we should engage ourselves in continuous medical educations, which are ongoing here and there. Now it is very comfortable that we can have it at home by this social media and on your own platforms. Friends, also keep an eye on legal judgments and what media tells against the doctors. Many doctors are punished for small things. Many doctors are basically sued for small things. So we should have eye on this. Now nobody reads newspaper because there is no time. But on WhatsApp news, that if any news comes on the website, we should have an eye on this. So once in a month, you can, whenever it is a Sunday, some legal judgments from doctor's point of view, if you put the keywords in Google, you will definitely get it. Now, I will come to the little bit end part. Now, take-home message I would like to give everybody. What is the take-home message? Work in the square and skill of knowledge which we are taught. What we are taught during our school days. Which school days? Homeopathic school days. That is our undergraduation days. Because now different schools of homeopathy are there. So we should practice in that area only. That is very important. We should involve colleagues in managing difficult situations if required. See, suppose if any patient's emergency comes to my OPD, I should call the nearby colleagues of me to kindly come and help me. If the relatives are making mess, if the patient is serious and you want to shift him, so be friendly with your colleagues nearby you. Don't look them as competitors. Don't look them as comparison people. Call them and take help of them. So we should involve them. Also, we should involve the specialty branches also. For example, if you are having any cardiac case and if you are giving homeopathy, you should have a cardiologist opinion at least once taken for the patient's heart. We cannot be all specialists of all branches. Okay. So involve friends and involve specialists also without hesitations. Keep thorough informations about the laws related to doctors and keep yourselves updated. This is very important. See, it does not mean that you should go in the courtroom and say, sit there, but in our associations, in our groups, you should discuss sometimes that now what are the things in favor of a doctor, what are the things if anything has gone against the doctor, at least keep them discussing. So that is very important. Now keep the essential things which I mentioned in your clinic prepared so as to save you from legal problems. Legal problems are raised. I am attending many people over here in Maharashtra, and sometimes small deficiencies basically bring them into trouble is my observation. So friends, thanks for like I will thank IFPH International Forum for promoting homeopathy and definitely giving me this opportunity. So I would like to thank everyone. This is my last year LLB course. You never know who is with you. A person standing left to me is a JMFC judge now. JMFC means first class judicial magistrate. So like our batchmates are also
Okay.
the same. They are all very big this thing, and we should be all together and take help of everybody. So basically, I thank you all for that. If you want to communicate anytime, you can surely communicate to me by WhatsApp message or by you can calling me. I myself own a homeopathic YouTube channel, Dr. Bawadekar's Homeopathy. When time permits, I kindly view it. So I finished a little bit early. I would like to have any questions to be answered. So I will kindly hand over this thing to Dr. Danesh sir. Thank you. Yes.
Thank you, Dr. INDRANEEL Bawatekar. It's really a very good session. And this kind of the knowledge you share about the law is really brilliant, because most of us, even though we know some of this, but not all, not everything, as you mentioned here. It is a must, so that we will have to promote this video to among almost all doctors so that they can understand what is written in the law. For example, you saw the why this fire
Firefighting equipment. It is very
fighters are
essential.
needed in
Yeah.
this situation, and yeah, and even you can purchase it by the 800 rupees also, and that's
Yeah.
also a knowledge. And you also mentioned about what are the things you need to keep. What is the importance of keeping the records in in your clinic? Whether when it is a child, how much, how long we have to keep, and otherwise how much it is clean, whether it is 3 years or 5 years, like that. So all these they are written in the laws, but unfortunately most of us are not aware of this. And anyway,
Absolutely.
it is the time for discussion. Those who can and talk to those who want to talk to Dr. Indraneel Bawatekar can raise your hand so that we will allow you to mute yourself and speak. Anyway, congratulations. Thank you.
Thank you, sir. Thank you, sir.
Dr. Manoj is always there.
Yeah.
Yes, thank you, Dr. Dhanesh and Dr. Daniel. It was a nice presentation indeed, most needed one. But unfortunately, we are not at all paying much respect or interest on this. From the number of participants is very visible. But what is happening is that some problems arising, definitely these persons will suffer. Without the ignorance is the main cause. Then you mentioned about this penalizing for giving advertisements. How many allopathic institutions were penalized in the last couple of years?
Beg your pardon, sir. How many?
Allopathic institutions for giving these advertisements were penalized. I think none of them were penalized.
I'll tell you. The reason is this. I know this because this is a very common question asked to me also. What happens, the court has basically take a action when somebody complains it. If there is a no complaint, then no action will be taken. And many even layman people are not aware that doctors are not allowed to do advertisement. In fact, doctors are not allowed, even lawyers are also not allowed. All the professionals are not allowed to do advertisements. So they can put their own board. But up till now, nobody has raised any objection for these advertisements. So it has not come in the eyes of law. They have recorded it, but they don't have time. So many cases are pending in front of the judges. So like these things are not coming up.
Why no such complaints are coming? That's another question.
what happens, like we see that everyone has got his own personal life. They get a fear that probably some wrong attack will be on them, something will be there, and people don't complain. That is the main thing.
But I think otherwise, because they're the medical councils or this ICMR, they will always support the doctors. But in fact of the other systems, they will not support doctors. Especially in the case of Patanjali, what happened? Even though they are a very high firm, they are not supported by the medical council, either the medical council, the Indian medical council, no, indigenous medical council not support Patanjali. Then who told to these fellows this asthma is not curable? So the courts, the honorable courts are unfortunately depending upon certain textbooks designed by the allopathy schools. So we must act on that also.
Surely, surely.
The same
Actually,
problem came, yes, the same problem came in case of COVID. It's because it was not curable according to the textbooks. So
Yeah.
when we give medicines, they questioned. It was not there in the textbook. So we have to modify the law
Yeah.
according to for the betterment of the society, not for the homeopathy doctors. Because always it is a common man. The people are suffering. We all know that these fellows are blindly approved the COVID vaccines. You know what happened?
Actually, sir, yeah, court takes a note of this. I will tell you, like we are following the Indian Contract Act of 19 roughly 73 to 83, but they make amendments and they put some insertions. Now I'll tell you, the handwritten notes were taken as a primary evidence in court of law. If any doctor's case record comes in front of the judge, now they have accepted the electronic record. This was the need of the society, because
Yes.
now we all do homeopathic softwares are there, the case papers are there, then we generate all electronic and digital media. But now they have changed, they have made an amendment that electronic record is also a primary evidence now. So court definitely makes some changes. It goes on as per the demand of the society. It definitely goes on.
Anyway, I think it is up to the Central Council of Research in Homeopathy as well as NCH. They have to act proactively. They are not
Yeah.
I think I suspect so.
Yeah. In the our like our code of ethics and all, they have mentioned all these things, even about the qualities of a registered medical practitioner, then all the office bearers, everything they have mentioned in the law. Then is that way they are
Anyway,
quite complete.
we are fortunate enough to have persons like you qualified in law. That's the greatest advantage we have. Thank you.
Yes, sir. Yes, sir. Actually.
Now I invite Dr. Bimesh Arora. You can unmute yourself and talk to Dr. Indraneel Bawatekar. Dr. Bimesh, please unmute yourself because you are writing something there here. Dr. Bimesh, please unmute. Arora.
Yeah, hi, Doctor
Yes.
Indraneel. Thanks for this legal processes. I just want to know whether there are so many institutes are there. They say that now this is 1 year course for this RMP, registered medical practitioner in homeopathy. And they also claim that these are the legal cases where government Supreme Court has given the approval. If you have 3-4 years practical experience with any clinic of homeopathy, so without any degree, you can do the practices but after having the RMP, registered medical practice homeopath. Can you suggest on this?
Yeah, I'll suggest you. These were the old things, but sir, now they are having no value at all, because our any degree or a diploma practitioner should have from a recognized institute or a recognized university. Now in Maharashtra we have MUHS, Maharashtra University of Health Sciences. So you should have a recognition of it, and our National Homeopathic Commission should recognize this. But now, as per my knowledge, there are no diplomas available for homeopathy. Directly BHMS, postgraduate, and PhD levels are there. So if somebody is making an advertisement, we should clearly see, we should see whether they are authentic or no, and it should not go on their references. They should be cross-verified. Even in such cases, we people are there to cross-verify. In here also, I have seen many certificate courses. Actually, certificate courses are the main which are conducted, I will tell you. And certificate courses hardly have any value if they have not been accredited, or if they have not taken permissions, or if they are not going to register some practitioners in our state register, they have got no value. So I think I should not use the word, but like it is a wrong thing, and one should not promote. Like these are business activities, but you should confirm with lawyers or a doctor and a lawyer who is having both knowledge of this.
Yes, exactly. In the previous part, we have only B class practitioners, and thereafter DHM, DMS. We have DMS, and then DHM, then DHMS, and now it is BHMS.
And graded course was also given them, and they were advised to do a bachelor degree. Now hardly a diploma homeopathy practitioners practicing. If is there, is an old one.
So once the degree is in action, automatically all the other diplomas will be on, and that's what is written. Not only that, once you get a degree, you are not supposed to practice. You have to register under the medical council.
Exactly.
And then only then you get a registration number, and then you can practice. That is the point. That legal point also there. That's why. We know that some people have practiced from college, but they didn't register. So they are not, according to the medical council, they are not homeopathic doctors. So if you want to treat a patient, definitely you need that kind of registration. And once you get the registration, if you want to start the practice in your home, it doesn't matter much. But if you practice in a clinic, you have to apply the panchayat registration, then or municipality registration or corporation registration, then only one can practice homeopathy. This is not only homeopathy, all the system, whether it be homeopathy, or yoga, whatever may be. But unfortunately, people are not doing all this thing, and the lawmakers are making this law. Unfortunately, the implementing agencies are not implementing it in a proper way. That's why a lot of cops are practicing even now, and they are making such a advantage out of it because of the political connection with these people. Yes.
In Maharashtra now, a new thing is going to start. It will be information for all of you. Probably it may come to your states also. Now they're starting in a few months, like KYD. We see about KYC, but now they're starting with KYD. That is know your doctor. So now after some days, they will be making a QR code compulsory, which every doctor has to put outside his clinic. People will only scan it and they will know what is your degree, how many years of experience, which faculty you belong. And this will, make all the accuracy in practice in the eyes of law as well as for the patients also. And all the quacks, I will say, will be ruled out. Nobody will quacks will be practicing. So this thing is very coming nicely. It will be coming in like, Clinical Establishment Act. You must have heard about it. I don't know.
Yes, yes, we have a Clinical Establishment Act as well as a medical bill. As you rightly point out here, the most important point that we have to look into that is that the so-called medical bill was written as per the requirement of the allopathic medical profession, not because it was prepared by somewhere else and it was implemented here. That's why India is a place where eye system is there. So when a bill is being produced in the parliament or in the assembly, it should follow the laws of India because all these systems are there. So we need correction in the bill. That's why.
Many things are pending, but this KYD will be very helpful to all states because all the parties are going to make this KYD. Know your doctor.
Yes, we are not rejecting that. That's a very good thing. We should accept all those good things, but also we will have to challenge against those.
There are many things which are disagreeable. There are many things which are disagreeable. Actually, I am working with some advocates also. Very true. Very true. Correct.
Yes.
Yes. Any other one? If you have
Dr. Harrison, sir, do you want to speak? Harrison, sir.
If no questions, I will just tell you a simple case which like occurred.
Yes, that's good. That's good.
See, there was a homeopath. Some 3 years back, the case was here. He had worked in a pediatric hospital for 2 years. And after that, he had gone to his own village where he started practicing. And after going to the village, he used to practice very nicely. He used to do homeopathic practice. That was very true. And he was specialized in pediatrics. And actually, a court has decided a case which had come to them. Like a baby was born, many babies were brought to them. He diagnosed it as tuberculosis and treated it. Patient was not better. Again, after some time, second medicine, third prescription, they had gone to some this thing also. There's a second opinion. On second opinion, it was found as malignancy, and unfortunately, the patient had died. The doctor was sued in the court, and they said that he's a pediatrician. But the court asked a simple thing, that pediatrician means, are you DNB pediatrics or you are MD pediatrics? The answer was nil, because the doctor was not belonging to both of them. So the take home message was this, that many of the doctors, for experience, they work in different hospitals. Even our female staff works at gynec hospitals for gynec knowledge. It is really good. But in practice, we should not promote these things without any having a recognized diploma or a recognized post-graduation degree. Otherwise, we will attract medical problems. So these cases happened, and the court said that you should not show yourself as a pediatrician. As a family physician or from your own stream, you should show that. That was the judgment passed. Correct, correct. So we should take these small things in mind also.
Exactly. Those things are nowadays we can see that there are doctors who are, I am a cardiologist like that. But we are
Correct.
not supposed to write in that way. We can just as a physician.
Very true. We are primary healthcare workers and we are family physicians. We all are trained in OPD cases. We never managed any cardiac case in ICU only with homeopathy. Nobody has managed it. I am very sure. Not a single case. So like we should be all knowing our limitations, and we should not make tall claims with homeopathy. It's a really good science. It has got a scope and limitation, but it should work with the other systems of medicines, like holistic approach we can call it. So we should be so flexible in that.
Yes. What kind of advice you want to give to the new generation doctors?
Yes, very true. Now I don't know about your state, sir, but here in BHMS curriculum, now pharmacology conventional has been introduced in the BHMS course. So like after 2023 BHMS course, so like I would like to advise them that they will be having some knowledge about conventional medicines when they pass out BHMS. But that does not mean that they can stop homeopathy practice and do total allopathic practice, because it is only for the knowledge of us to know the side effects, to know the pharmacology, and our many patients are taking it. So we should know about these drugs. So that's why the subject is introduced, is my view. So kindly do not make, like giving big injections, doing some operations OPD level, doing some patients procedures. So kindly do not do in an OPD, even though you are expertized or you are, doing any work under any surgeon or any physician. Accept the cases which are taught to you in your graduation level. So that will be a take-home message for all. Okay.
Dr. Manoj.
Manoj sir, any query? Yeah.
I have a request. You said about this NCH Act. I think it is better to have a session from you on the NCH Act in the coming days. So definitely everybody will be benefited.
Surely, sir. The act is quite nice, and actually we all should be aware of act of our council. That is very important.
Yes.
And it explains everything. We can definitely think for this session. No problem, sir.
Okay, thank you.
As per your profile, it is written that you are a homeopathic nephrologist.
Yeah.
And it is your experience in that way.
Yeah, I'll tell you. Actually, I have got, many conventional nephrologists and myself. We have a debate every day in big hospitals. I am always called as a second opinion doctor for homeopathy when the kidney shut down completely and the patient is about to die, to be very honest. But I explain them that my role is for chronic kidney diseases, which are OPD patients, and along with conventional treatments, my pathy is a supporting pathy. And from our homeopathic knowledge, I support these patients to improve their quality of life. So that is very important. There is a difference between a nephrologist and a urologist. Can anyone comment on this? What is
Yes.
the difference?
Yes, definitely. The difference between is that a person who is treating the urology condition are supposed to be a urologist, and a person who is treating the kidney and its function and disorders are
Very true, very true, sir. Very true, sir. I should appreciate your this thing, because many people don't know. And actually, I did my dissertation for MD in management of chronic nephritis with homeopathic medicines. So that was my subject. And if the subject is taken, you can work in that field by law. But when I display my degree, it is always displayed as MD Homeopathy. That is very important. Correct.
Okay, if anybody have any question, please raise your hand. Nobody is still
Yeah, they can feel free. Actually, for question answers, I have wind up a little early because many questions may be in mind.
But unfortunately, the participants are very less. That's why questions are also not
No
coming.
problem. No problem. No problem, sir. In future also, if any
Yes.
question comes, we can definitely
Yes,
answer them.
Dr. Bimesh Arora, please come forward and you can ask the question directly. Please unmute. Please unmute and some question was written in the chat box.
Yeah, generally as I'm searching all the things here and there, as Dr. Saab saying ki in Google search every once in a week for 1 hour, you have to search for what is happening in law, what is happening in practice type of thing. So I was searching this type of company. This is in Calcutta-based company. So they are claiming ki now this High Court Commission Chennai planning. You seeing my chat na? So as per this thing, ki, that person can do the practice, but not put the DR name, prefix the DR. So that's why I'm just searching, Googling, so that's why I taken this reference for you.
Okay. Actually, sir, our all practitioners, they should be admitted by our councils. That is the main thing for registration number. Dr. Dhanesh has pointed out very nicely. See, taking a degree is a different thing, and for taking a registration number for practice is a different thing. So, whatever courses anyone may do, if they are not registered by our councils, they are not recognized and they cannot do practice.
Right.
Dr. Arora, please introduce yourself. You are
Yeah.
from which part and we are practicing which part? Yeah, are you practicing?
Are you practicing and are you homeopath, sir?
Okay. Okay, it's up to Dr. Manoj to say what are thanks to the session.
Thank you, Dr. Dhanesh and Dr. Indraneel. Definitely, he has got his own potential and he proved it. Because formal education is always further enhancing our quality of this intelligence as well as our brain. That once again is proved. Nice presentation, and we are expecting more positive presentations from you. So with that remark, let me conclude today's edition, and on behalf of IFPH, once again express sincere thanks. Thank you. Yes, Dr. Dhanesh, please. Yeah, muted. Please unmute.
Thank you, Dr. Manoj, Dr. Indraneel Bawadekar, and those who attend the session this evening. And tomorrow we will have a session from Dr. Javed Akhtar from Pakistan, and the subject of discussion will be magnesium remedy and their cases. With that, we come to the end of the day 1639. Thank you all. Good night. It's over to Dr. Mariama John to moderate the Malayalam session.